And we are talking about the child with altered cardiovascular and hematologic status. We're going to talk about the concept of cellular regulation. We first need to discuss anemia. As you can see here, normal anemia is defined with hemoglobin less than 8. All right. Children with sickle cell disease, the range is between 6 to 10, so it's even lower than that. All right. The anemia is caused by a destruction of the red blood cells. All right. Sickle cell anemia is usually evident by 4 months of age. The reason is, I hope you guys can guess, is because it's not usually noticed at birth or the first 4 months, even though they're screened, because it takes about 4 months for the maternal hemoglobin cells to start dying. So before that, they have the mother's normal red blood cells, and it's very hard to diagnose this unless they already know of a genetic issue with the parents within the first 4 months because of the mother's hemoglobin. All right. You can see here, it is a group of hereditary disorders. It is related to a presence of hemoglobin S. The most common form of sickle cell disease, which is a group of disorders, is going to be your SCA, which is sickle cell anemia. That's the one we're going to talk about today. Sickle cell C disease and sickle cell thalassemia disease. All right. The sickle cell C and the sickle thalassemia disease, those are hemoglobin C and S, and they don't turn into mature red blood cells just like the sickle cell anemia, but it's a little different, okay? It is transmitted by a recessive gene. So what that means is that two parents have to be a carrier, all right, to cause a child to have sickle cell disease. And you can see here, this is like one of those Punnett squares, right? So this one won't have any of the traits, this will have a trait, this will have a trait, this one will have the sickle cell disease. Now, does that mean that if parents have 4 children, one and they both are carriers, one will have sickle cell disease? No, that's not what they mean. It's basically 1 in 4 odds each time they have a child that they have one with sickle cell disease. You may see parents who both carry the trait who never have any children with sickle cell disease, or you may see parents who both have the trait who have multiple children who have sickle cell disease, okay? All right, so what basically happens is that normal red blood cells live about 120 days, all right? They survive about 120 days, right? But sickle cell disease red blood cells have a much shorter survival time. They survive about 30 to 40 days, okay? When there is a sickle cell crisis and those cells sickle or turn into these almost C-shaped things, they no longer can carry oxygen, all right? So 2 things occur when the cells start sickling, all right? 1, they cannot carry oxygen, So we have an oxygenation issue. And 2, because of their shape, they tend to pull together to cause obstructions. All right. So it causes thrombosis. The next one talks about infarct. So it stops blood to spleen, brain, heart, lungs, GI tract, kidneys, and bones. All right. And it causes venous pooling. Again, once the cells turn into the sickled shape, they can no longer carry oxygen. All right. So there's 2 different things working here when these cells start to sickle. There is a clumping issue and an oxygenation issue. All right. So triggers, things that cause it. Well, dehydration. So if the blood cells start to become more hemoconcentrated, this can cause sickle cell crisis, all right, or cause the cells to sickle. Infections, physical or emotional stress, exposure to cold or humidity. Humidity is another one. Exercise intolerance, changes in altitude because there's less oxygen concentration the higher the altitude, so things like that, all right, cause the cells to sickle. All right, so what does this do? We talked about some of the things. Generalized, that children usually who have sickle cell anemia have delayed growth, so they consider this a growth retardation, and they will have chronic anemia, so chronic less amounts of red blood cells. Okay. When they have a vaso-occlusive crisis, so when those cells sickle and they are pulling together, the main symptom is going to be pain. It's extremely painful. Okay. There is swelling of the hands and feet that occur. Severe abdominal pain occurs. Strokes, visual disturbances, pneumonia, obstructive jaundice, and hematuria can all be caused by those vaso-occlusive crises. The sequestration crisis is a pooling of large amounts of blood that occur in the liver and the spleen, and that causes them to enlarge. This can actually cause circulatory collapse because there will be a decrease in blood volume and then shock occurs. Okay. The effects of chronic vaso-occlusive phenomena, well, they are chronic cardiomegaly with murmurs, altered lung function, frequent pneumonia, which we've talked about, kidneys that cannot concentrate urine. They can have kidney failure, hepatomegaly in the liver, cirrhosis of the liver, splenomegaly, infections, blindness can occur from the occlusions. They may develop avascular necrosis, so usually that occurs in the hips or the shoulders, and they could have strokes and seizures. All right. So here are the symptoms. There's that unusual swelling of the fingers and toes. That's actually called dactylitis. It's one of the first symptoms, okay? They will drink excessively and urinate frequently. So this poses a problem with potty training and things like that. You can see the rest there, and pain is underlined and bold. It is significant. All right. It is significant. Lab studies. Again, It's mandatory screening, newborn screening in Pennsylvania, but remember what we talked about, not often caught that early due to the maternal red blood cells. Hemoglobin levels, when they become low, are an indication. So reticulocyte count, so what this is this is a count of the immature red blood cells. So usually in a patient with sickle cell, they have a very much higher reticulocyte count. But I will tell you, when they are in a crisis, that count tends to drop very quickly because those cells are no longer viable, so they won't be counted in that reticulocyte count. All right, so during a crisis, that count will go down. Those hollow jolly bodies and the Heinz bodies, those are very specific for sickle cell anemia. They are certain types of DNA that move around the erythrocytes, just so you know. Liver function studies, this will show if there's any liver dysfunction due to the damage of the small vessels around the liver. Renal function studies, so this will let them know if there is any decrease in renal function related to the sickling of the blood vessels. PFTs are going to help with assessing lung disease or fibrosis. Fibrosis can occur from those blocked blood flow. EKG to look at the heart, chest x-ray. So all those can be done during a crisis. So when the child, even an adult, is in crisis, you can see here, it can be fatal. They will appear acutely ill, very ill. You can see all those, you can see the list there. The temperature is a systemic response from the body. Convulsions, nuchal rigidity. So what does that remind you of? Hopefully that reminds you of when you are looking up meningitis and they discussed the soreness in the neck, right? And then you can see the jaundice, the coma, and paralysis. And jaundice is very obvious, especially if they are darker skinned. All right. Interdisciplinary management. So what are we going to do? Well, we want to try to treat the symptoms and be supportive. We want to put them on bed rest because we want to try to reduce the oxygen demand on the body. Give them oxygen. Give them morphine, right? Usually for pain because they're in intense pain. You can see all these things, antibiotics, treat dehydration. So all those things are treating the causes, all right? So it's very important to treat the cause. They may need a blood transfusion. So if they have sickle cell disease and it's they're not as stable medically speaking, some patients require routine blood transfusions. Blood transfusions entail transfusing blood because they're going to have those mature blood cells available. All right, and that does help a lot. You can see there IV fluid, daily weights, H&H, move those joints slowly and support them due to the pain. Okay. All right. So we talked about this. We're going to give morphine usually. That's what we often do. You can see there, maybe Dilaudid as well. Calcium channel blockers. So that's a targeted therapy that relaxes the muscles around the blood vessels. It will help reduce the blood pressure as well. Let's see what else here. Oh, the hydroxyurea or hydrea. Those are medications that are used to manage pulmonary hypertension, okay? They also can decrease painful episodes by managing pulmonary hypertension. They're actually anti-metabolites. So all those things are very helpful. Also helpful, antibiotics to prevent and treat, so to help reduce the sickling. So an infection will allow the red blood cells to sickle, and giving penicillin V will help prevent that, okay? And immunizations will help prevent illness, and then the blood transfusions if necessary. We are going to do a case study together. All right. When we get together for class, it is the sickle cell case study. Also, nursing diagnoses that pertain to sickle cell anemia, and you can read them there. Ineffective tissue perfusion, caregiver role strain, risk for interrupted family process, delayed growth and development, impaired physical. So all those are really good ones, okay? We are going to go over some NCLEX questions in class. And this will conclude the lecture on a child with alterations in cardiovascular and hematological status.